Hi everyone, thank you for joining me today on this lecture called Specialists in the Schools and What They Do. Before we get started, I would like to share some information about myself. I am currently a doctoral student at UCR in the Department of School Psychology. Before entering graduate school, I worked for a couple years as a special education teacher. In this position, I got to be a case manager where I coordinated students' services with specialists, many of whom I will be going over today. I also worked with these specialists on multidisciplinary teams during individualized education plan meetings where we discuss goals and services for a variety of students. Next, I will discuss an overview of our lesson for today. Today we will be covering the following specialists in the schools. We'll be covering school psychologists, school counselors, school social workers, behavior analysts, special education teachers, intervention teachers, speech and language pathologists, occupational therapists, and physical therapists. Of course, I'm particularly passionate about talking about school psychology as this is my field of study. So what are school psychologists? School psychologists are uniquely qualified members of school teams with expertise in improving the academic, behavioral, and mental health outcomes of children, youth, families, and schooling processes. They receive extensive training and graduate preparation, which develops their knowledge and skills in many areas, some of which include data collection and analysis, assessment and progress monitoring, consultation and collaboration, academic and learning interventions, behavioral interventions, instructional support, and mental health services. School psychology is a general practice of health service psychology, and it includes the coursework in both clinical psychology and educational psychology. School psychologists provide direct support and interventions to students, consult with teachers, families, and other school-employed mental health professionals, such as school counselors and school social workers, to improve support strategies, work with school administrators to improve school-wide practices and policies, and collaborate with community providers to coordinate needed services. As such, school psychologists are versatile in what they can provide. Some of these services include psychoeducational assessments and educational assessments, intervention, prevention, health promotion, individual and small group counseling, involvement in school crisis teams, and program development focusing on children and youth development within the context of schools, families, and other systems. Knowledge of cultural context to address culturally or linguistically diverse individuals, and in learning and effective instruction and family and parenting processes are also critical to their roles. Generally, school psychologists have a high national demand. The Bureau of Labor Statistics projects that 3.1% employment growth for school psychologists between the years of 2019 and 2029. In that period, an estimated 5,300 jobs should open up. These jobs, it's important to note as well that school psychology actually scored as one of the top 20 jobs in social services job according to U.S. World News Report. The average annual salary for school psychologists nationwide is roughly $78,000, and in California specifically, it is over roughly $108,000. This tends to be well above the average salary that most school personnel make. School psychologists must be credentialed by the state in which they work. They may also be nationally certified by National School Psychology Certification Board. The National Association of School Psychologists sets standards for graduate preparation, credentialing, professional practice, and ethics. The reason why you may want to get the National School Psychology Certification Board is because it can allow you more flexibility in states that you work in, whereas only going by state licensure may mean that if you move to another state, you would have to go through another set of requirements in order to be qualified to work in that state. School psychologists typically either complete a specialist level program degree, which is at least 60 graduate semester hours, or a doctoral degree, which is at least 90 graduate semester hours. Both of these include a year-long 1,200-hour supervised internship. The vast majority of school psychologists work in K-12 public schools. They also provide services in a variety of other settings, including school district administration offices, universities. Typically in university settings, you can get a job as a professor if you get a PhD, or you can work as a mental health service clinician with both a PhD and a master's level certification. You can also work in school-based health and mental health centers, community-based day treatment or residential clinics and hospitals, juvenile justice programs, and independent private practice. The reason I chose personally to get a doctorate degree over a specialist degree is because I can become a licensed psychologist, which can provide me with a bit more flexibility and credibility in the types of jobs and positions I can look for in this field. If you have any more questions about school psychology, please do not hesitate to contact me. My email address is on the syllabus. Next, we will be talking about school counselors. Oftentimes, people who are unfamiliar with the different roles may confuse school psychologists, school counselors, and school social workers. Although some of their responsibilities do overlap, they do have distinct roles. Right now, we're going to watch a short clip explaining what school counselors do.
Would you enjoy a career in which you effectively guide young people in navigating the challenges of school and making such important decisions as choosing where they go for higher education? School counselors are also important advocates for students. Imagine helping students who are struggling with bullying or having difficulties at home that affect not just their emotional well-being, but their performance in school. A school counselor is often the greatest source of inspiration to a student. School counselors work mainly within the school setting, but can also work in a private practice. Working as a school counselor proves to be a highly rewarding career with years of satisfaction. This could be the right career for you.
So as discussed in the video, school counselors are highly educated, professionally certified individuals who help students succeed in school and plan their career. An integral part of the total education system, school counselors help students form healthy goals, mindsets, and behaviors. With the aid of a school counselor, students learn to develop effective collaboration and cooperation skills, to practice perseverance, to develop time management and study skills, and to learn self-motivation and self-direction habits. School counselors help all students apply academic achievement strategies and manage emotions and apply interpersonal skills and plan for post-secondary options. Some of the other duties of school counselors include individual student academic planning and goal setting, school counseling classroom lessons based on student success standards, short-term counseling to students, referrals for long-term support, collaboration with families, teachers, administrators, community for student success, advocacy for student at individual education plan meetings and other student-focused meetings, data analysis to identify student issues, needs, and challenges, and acting as system change agents to improve equity and access, achievement, and opportunities for all students. The job growth for school counselors is also high. They are projected to grow to 13% from 2016 to 2026, which is above the national average. The mean annual pay nationwide is around $67,000, whereas the mean average pay in California is around $78,000. School counselors require a master's degree from an accredited institution, usually in a field relevant to school counseling, along with state certification to start practicing. School counseling master's programs typically teach practical skills such as facilitating student development, conducting individual and group counseling, and working with parents. Masters in school counseling programs want to best prepare their students to start their career on the right foot. While completing your master's program in school counseling, it will be required of you to complete a supervised internship hours in a school setting, typically under a certified school counselor. Next, let's talk about school social workers.
Issues.
Let's start this video.
Hi, and welcome back to my channel. Today's video is going to be about school social work. School social workers are uniquely trained to address the social and psychological issues that can block or hinder a student's academic progress. We do this by identifying and addressing very complex issues, meeting the needs of the child as a whole. Many school children and teens are faced with significant obstacles to learning, such as bullying, child abuse, substance abuse, gang violence, teen pregnancy, domestic violence, suicide, and or other personal crises.
On top of all of those social and emotional issues, you're dealing with the school issues as well, which are going to be failing grades, truancy, lack of motivation in school.
We work alongside principals, teachers, counselors, and community members. Many times we get confused for school counselors. The areas that school social workers and school counselors deal with can definitely be similar, but in general, a counselor is much more focused on schedules, grades, and ways to help a student succeed in their schoolwork, while social workers are going to focus on behavioral, mental health, and the home life of a student. What sets us apart greatly from other school staff is our ability to make home visits.
And part of being a school social worker is reaching out to families that we can't reach in general by phone or emails or correspondence, letters, things like that. If we can't open those lines of communication, let's say that, then the social worker is sent out to go to the home.
Place of employment is also a big difference between school counselors and school social workers. Virtually every public school employs a school counselor, but not every school employs social workers. In urban settings, especially low-income schools, many administrators and school boards find that school social workers are integral to their students' success. Another difference in place of employment is the fact that counselors are employed at a particular school while social workers are usually district employees, meaning for a school social worker, it's not uncommon to have 2 or 3 schools on their roster. Social workers in schools often pick up where other school staff leave off. We assess social and psychological issues that can block academic progress in students. We provide individual counseling, group counseling, case management, crisis counseling, intervention planning, community outreach to link students to resources to ensure basic needs are met, and professional development. I hope you enjoyed today's video. I'm wishing you all social work.
So this video summarized very well what a school social worker does. So, as stated in the video, a school social worker is a professional responsible for helping students, parents, and school staff identify problems that impede learning. Their ultimate goal is to successfully address emotional, social, and academic issues so that students live a healthy, safe, and balanced life. When students experience a dramatic lifestyle change, their personality and schoolwork are usually affected. With the help of school social workers, students receive help such as crisis intervention, counseling, and prevention programs that provide them a chance at academic success. Looking at the slide, other duties that a school social worker performs include identify students in need of help, assess students' needs, situations, strengths, and support networks to determine their goals, develop and evaluate programs and services to ensure that basic needs are met, help students adjust to changes and challenges in their lives such as illness, divorce, homelessness, or parental unemployment, research, refer, and advocate for community resources such as food stamps, childcare, and healthcare to assist and improve a client's well-being, respond to crisis situations such as child abuse and mental health emergencies. The salary of school social workers varies. Looking at this next slide, depending on factors such as their level of experience, level of education, and geographic location. Generally, secondary and elementary schools offer the highest salaries for school social workers in most locations. Those with a master's or doctorate degrees also often have the highest pay. The job growth is very high for this position, and it's projected to grow to 16% from 2016 to 2026. According to the Bureau of Labor Statistics, the mean annual pay for social workers nationwide is around $62,000. However, in California, the mean annual pay is around $73,000. A bachelor's degree serves as a critical step in becoming a school social worker and includes courses in human behavior, social work methods, social policy, and fieldwork. However, even if you do not get a bachelor's degree in social work specifically, you can still apply for master's programs. I have several friends that applied to get their master's in social work while having degrees in different fields during undergrad. While the education requirements for this profession varies by state, most states typically require school social workers to earn a master's degree in social work, or an MSW, from a program accredited by the Council on Social Work Education, and to complete coursework in mental health assessment and treatment, youth and family relationships, human development, and school violence prevention and intervention. An MSW program commonly lasts 18 months to 2 years and qualifies graduates to earn their license. Getting an MSW allows you to have a lot of flexibility in where you can work. In addition to working in schools, social workers can work in mental health clinics, child welfare and human service agencies, hospitals, settlement houses, community development cooperations, and private practice. Next, we will be talking about behavior analysts.
I often get the question a lot, what do I do? And over time, I've been able to really put together a pretty basic understanding of how I could explain that. And when I'm asked what a behavior analyst is and what I do, the first thing that I generally tend to say is, as a behavior analyst, we work with individuals that may have an intellectual or developmental disability, or may have some type of a communication deficiency. And that encompasses a great deal of what we do. As a behavior analyst, we do observations, we do assessments, paper methodologies such as interviews with individuals. We take data. When I speak about data, I'm referring to if I'm looking at an individual in a natural setting, which is very important. A natural setting would be a person's home, or a person's classroom, or a person's work environment, and try to get an understanding, a large understanding of what the behaviors are that need to be targeted. So as a behavior analyst, we want to go in and we're very specific in what we term operationally defining the behavior. So a lot of times when you're trying to look at trying to get at a function of a behavior, function being what is the reinforcement of the behavior, you term that the function of the behavior. So you want to identify what that is. One of the things that sets us apart is once we determine the function of the behavior, we can then move on to putting appropriate teaching skills or develop a program that is going to reinforce more appropriate behavior.
So the video covered behavior analysts very well, but to reiterate what the video was saying, behavior analysts apply principles of applied behavior analysis. And if you don't know what that means, briefly, applied behavior analysis, or ABA, is an evidence-based behavior therapy that focuses on developing appropriate behaviors in patients while minimizing negative behaviors such as aggression or self-injury. ABA can be effective for children and adults. It is most commonly known as a therapeutic intervention for individuals on the autism spectrum disorder, as well as for those with ADHD. However, ABA can be very effective in supporting all types of children and adults with different behavioral needs. ABA can be practiced in a variety of settings and help individuals manage the lifestyle challenges that accompany their conditions. Some of their job duties include identifying target behaviors that can be readily observed and measured. Patients' treatment plans depend on their individual needs, and ABA interventions require monitoring and continuous evaluation from session to session. ABA therapists evaluate patients' behaviors to develop treatment plans to improve their communication and behavioral skills over time. Next, they also conduct observations and assessments of behavior in the natural environment. They focus on identifying the function of behavior, why the behavior occurs, and they create behavior intervention plans to decrease problem behaviors and increase adaptive behaviors. So the job growth for behavior analysts is pretty high. According to the United States Bureau of Labor Statistics, employment of all professions in the psychology fields, including applied behavioral analysis, is projected to rise 19% across the country by the year 2024. This rate is significantly faster than average for all professions. According to PayScale, applied behavioral analysis typically make between roughly $26,000 and $72,000 per year, with a low percentage making more than $90,000 annually. Generally, average pay is roughly $59,000 nationwide, and in California, it's closer to around $70,000. To become a behavior analyst, a graduate degree along with a bachelor's degree in health science can help you earn a master's of science in applied behavioral analysis. You can also get this degree typically when you have an undergraduate in education or psychology. Upon graduating from the master's program, prospective behavior analysts must acquire work experience through either supervised clinical work or through another setting. The next and sometimes final step is to pass the national certification exam, which is required to qualify for board certification. Some states also require additional requirements for state licensure. There are many potential career paths available for qualified credentialed behavior analysts. These professionals often work in healthcare, education, mental health clinics, or even with private clinics in social settings. They can advance their careers by enrolling in continuing education programs and joining professional organizations. There are also PhD programs for further ABA studies. One thing I wanted to note is that UCR recently had added an applied behavior analysis program where you can get your BCBA, which is the certification that would allow you to practice in most states nationwide. So UCR is a great program to look at for continuing graduate education. And obviously there's a school psychology program and a special education teacher program, which is what I'm going to be talking about next. So who are special education teachers? As I stated when we first started this presentation, I used to work as a special education teacher for several years before transitioning to school psychology. From my experience, special education teachers wear many hats. Unlike other teachers who focus primarily on academics, special education teachers serves both as an educator and as an advocate for students with special needs. As such, your schedule can be divided among planning, instruction, assessing students, and managing their individualized education plans. Looking at the responsibilities, bullet points here, the job can be quite demanding, and it does require the teacher to juggle many responsibilities. These can include scheduling, attending, and following up after IEP meetings, writing IEPs with attainable and measurable goals, tracking and reporting student progress on IEP goals, providing guidance to general education teachers who wish to accommodate students, administering assessments, day-to-day classroom management, planning and instructing, managing and evaluating instructional assistants and other paraprofessionals, and developing behavior management plans. And there might be some other responsibilities depending on the district that you work for. So as some other duties included is also you will teach and mentor students as a class, typically in small groups, and you may also be doing some one-on-one work. You will also be assessing students to determine their needs, adapting general lessons to meet the needs of students. You will also plan, organize, and assign activities that are specific to each student's abilities and goals. And you'll work as a team to develop the individualized education plan for each student. You will also implement IEPs, assess student performance, and track their progress. All the personnel that I've been talking about today can be potential members of the IEP team, but typically special education teachers are the ones that will be leading the case management. So what that means is that they will be the ones kind of coordinating all of these individuals together in order to provide services for individual students that need those types of services. So the job growth is also good for this profession. It's projected to grow by 8% from 2016 to 2026. The mean annual pay for special education teachers nationwide, according to the Bureau of Labor Statistics, is around $66,000. And then in California, average pay is around $70,000. For the education needed, teachers who hold, so those specific teaching license requirements vary from state to state. Federal legislation through the No Child Left Behind Act requires special education teachers to have a bachelor's degree and to complete a teaching preparation program that includes supervised student teaching. Upon successful completion of an accredited program, prospective teachers can apply for a preliminary credential, which generally expires after 5 years. To obtain a clear or permanent credential, teachers must complete continuing education courses and serve as a classroom teacher for 2 or more years. Some states or districts will offer what's called emergency credentials for teachers who are willing to take hard-to-fill positions. In this case, a teacher forgoes the unpaid student teaching requirement and assumes all responsibilities of a teaching position while completing credential classes after school hours. So another thing to note about special education teaching credential is that you actually specialize in different areas. So some example of the specializations you can get is early childhood, mild to moderate disabilities, moderate to severe. You can also get a specialization in deaf and hard of hearing. So to talk a little bit more about my experience, I hold a credential in my mild to moderate, and what that means is that you often work in a resource specialist program or RSP. In some cases, you may also work at special day classes, but typically the type of students you're working with have mild academic or behavioral difficulties, and they can often be very successful with limited or moderate special education intervention. Generally, this credential authorizes a teacher to work with students from kindergarten through age 22. So that's something else that's unique about the special education degree, is that you are qualified to work with children with all age ranges. With a moderate severe credential, teachers can work in fully contained classrooms. These rooms generally offer basic and functional skills instruction for students with severe cognitive or physical disabilities. Generally, this credential also authorizes a teacher to work with students from kindergarten through age 22. My suggestion, if you are unfamiliar with these types of credentials or these types of settings, or want more information about the types of students you want to work with, I would recommend shadowing teachers and see what type of position you would like more. If you have any specific questions about going into special education teaching, please don't hesitate to contact me. Next, we will be talking about reading interventionists. This is a little bit of a more specialized teaching position, and it's may or may not exist depending on the district and what they're looking for. But a reading interventionist teaches reading skills to students struggling with literacy. As a reading interventionist, you help students learn the basics of reading, such as learning letters and sounds, and progress in their reading skills. Your job duties include, what's here on this slide, includes attend to the academic needs of students who have been identified as at risk for reading difficulties, provide and implement reading interventions in one-on-one or in small group settings with students who are having difficulty reading at grade level, assess students' reading abilities, identify areas of need, and create intervention plans for students selected for additional reading instruction. You will also be monitoring student progress towards their goals, and you'll be working closely with teachers to ensure that reading interventions that students receive are aligned with the curriculum taught in class. The projected growth of this position is 7% between the years 2014 to 2024. The median annual pay nationwide is around $60,000. And the median annual pay with a focus on curriculum development is about $64,000. In order to be qualified for this position, at minimum, you at least need a bachelor's degree, and typically you would want to get a bachelor's degree in education, reading education, or literacy. You also need to get a state-issued teaching credential, and then a postgraduate certificate or degree in reading or literacy, and you need to pass a state test for reading specialist endorsement. Typically, they will provide services in public and private elementary schools. All right, next we'll be talking about speech and language pathologists.
Well, it's important for schools to have a speech-language pathologist because oftentimes we have kiddos that have language delays or have articulation delays, and it limits their ability to access their curriculum.
There's so many things.
Oops. Sorry, sometimes the video has been going off, so thank you for your patience for everyone who's watching this.
That we work with articulation, language, stuttering, and voice. Those are the 4 performance areas that we look into.
Math is language-based, reading is language-based, and so that's what we help them with also too, to get a good foundation and to be able to excel in those academics.
So if you're in the schools, you have this huge influence. You get to see them most of the day. You get to see all the places they communicate. And a speech pathologist can go in, study what they have to understand academically, pick out why the child can't do their best. There could be something in their language, something in their speech. They can give those kids the tools.
There are a lot of students with disabilities in the school setting that require intervention in the area of speech and language. In fact, 25% of the students that are eligible for disabilities in the school system are students with speech and language disorders.
Well, schools definitely need speech pathologists to address the needs of certain kiddos that might have specific learning disabilities, difficulties with articulation, speech sound disorders, really to to be there to support a classroom teacher. So classroom teachers are now becoming a lot more aware of our abilities and are more receptive to us coming into the classroom, and so we start seeing our caseloads kind of skyrocket.
When we have a student that's suspected of having some disability, we have maybe the school psychologist, maybe a special education teacher, maybe a speech pathologist, all working together to try and really sort out if the child is eligible for special education and what their areas of need might be.
So we're always collaborating. Being a speech language pathologist in the schools, you have to be a collaborator. You work with so many service providers and you have to be flexible, because bottom line is we're working to make sure that these children are accessing the curriculum.
So if an individual is having difficulty communicating their wants and needs and others can't understand them, if the teachers can't understand the student, that impacts their self-esteem too. So we help them on so many different levels.
We are really in the schools to help kiddos access their curriculum. And the great part about that is that we can really help kiddos do better in terms of accessing their curriculum, interacting with their peers, understanding their teachers' expectations. And we have some skills that help kiddos know how to ask questions differently, how to get help differently, so that they can be more successful.
When the parents told me, it says, we were at a drive-through and my husband was saying, can you get him to keep quiet for a second? And I looked at him, she said, and said, do you remember a year ago we couldn't even understand what he was saying? And you're asking me to tell him to be quiet? He goes, you're right. This is great. Suddenly a father can have a conversation with their son, and a mother can have a conversation with her daughter. That's gold. We give them confidence in the ability to communicate. We allow them to unlock the keys to communication. And it's a gift that rewards both the provider and the student. I think as a speech language pathologist, what we give to the students is confidence. Confidence in the ability to communicate more effectively.
Okay, thank you for watching that. So I believe that the video also provided a really great explanation of speech pathologists. To just kind of reiterate what the video said, speech pathologists work to prevent, assess, diagnose, and treat speech, language, social communication, cognitive communication, and swallowing disorders in children and adults. As you can see from this list of duties, some of their responsibilities include evaluating levels of speech, language, and communication difficulties, identifying treatment options, creating and carrying out an individualized treatment plan that addresses specific functional needs, teaching students how to make sounds, maintain fluency, and improve their communication, help individuals improve vocabulary and sentence structure used in oral and written language, and counsel individuals and families on how to cope with communication difficulties. So the projected job growth for speech and language pathologists is 18% from 2016 to 2026. Again, this number is pretty high and well above the national average. Nationwide, according to the Bureau of Labor Statistics in 2018, the median annual pay is roughly above $72,000. And in California, the median annual pay in California is roughly above $93,000, which is according to salary.com in 2021. To become a speech and language pathologist, you need to apply for the Certificate of Clinical Competence in Speech Language Pathology. In order to get this certificate, you must earn a graduate degree and successfully complete the required clinical experiences and pass a national examination. In some areas, such as college teaching, research, and private practice, a PhD may be desirable. And also for all of these different jobs I've gone through so far, there is an option to get a doctorate degree in all of them. To earn the certificate, individuals must complete graduate coursework and a clinical practicum at a college or university whose program is accredited by the Council on Academic Accreditation in Audiology and Speech Language Pathology. This assures that graduates that their academic and clinical experience meets nationally established standards. And of course, speech and language pathologists can also provide a variety of services in schools and outside of schools. So they can also be working in hospitals and private practice. Next, I'll be talking about occupational therapists, and I'll be showing a short clip.
Turn stop. Perfect. I'm an occupational therapist. OTs basically help bridge the gap between what kids are able to do and what they need to be able to do, so that we start with 3-year-olds and work all the way till they age out at 21. The challenge in the school setting is that we need to make it educationally significant. So we typically work on handwriting skills, sensory processing, their attention, their ability to sit and to participate, and really just kind of all kinds of fine motor skills.
Which face are you going to pick?
I did it.
You did it.
I've been an OT for 18 years, and I've been with the school system for 14. Actually, I got into it by accident, and once I got into it, I absolutely loved it. Sometimes people will say, wait, you're the handwriting teacher. Why are you in there helping them with toileting skills? Or what do you know about behavior? What we do is we really look at the whole student, the whole person. It's not just the motor skills.
Can you make that one look like that one?
I absolutely love working with the kids and their personalities and all the differences that they come with, the challenges that they face, and then helping them overcome those challenges and seeing the pride and the success that they feel.
Good job.
You have to be able to interact with students on their level. And I think you have to be very creative. You have to be ready to just pump with whatever you're thrown during the day, whether you're working with a gen ed student who can sit and attend and maintain and benefit from your instruction in the first trial, to students who are really struggling and have multiple handicaps or severe behavior issues, or a 3-year-old who's in their first educational or structured setting for the first time in their life. You really need to be able to be flexible and meet people where they are and enjoy people.
Okay, so again, the video described really well what occupational therapist does. So to reiterate some of the points, interestingly, occupational therapy is one of the very few professions that allows you to work with people across the lifespan. And you basically are helping them do the things that they want and need to do through the therapeutic use of daily activities, which is kind of why it's called occupations. Occupational therapy practitioners enable people of all ages to live life to the fullest by helping them promote health and prevent or live better with injury, illness, or disability. Common occupational therapy interventions include helping children with disabilities to participate fully in schools and social situations, helping people recovering from injury to regain skills, and providing supports for older adults experiencing physical and cognitive changes. Occupational therapy services typically include, as we can see right here on this slide, evaluating a patient's condition and develop a treatment plan, identifying specific goals and the types of activities that will be used to help the patient work towards those goals, helping students with various disabilities perform different tasks and skills, including fine and gross motor skills, provide appropriate accommodations or interventions designed to enhance the student's potential for learning, assist the student in acquiring the functional performance skills needed to participate in and benefit from educational environments, and helping the student to function independently. So the job growth for this job is also extremely high. So the projected growth is 24% from the years 2016 to 2026. The nationwide mean annual pay you may expect to receive is around $75,000. And of course, in California, it's much higher. The median pay in California is a little above $100,000. To become an occupational therapist, you will need to earn both an undergraduate and graduate degree and pass the required licensure exams. You can expect to spend around 6 to 7 years in school, which includes 4 years from your undergraduate degree and then 2 to 3 years for the graduate degree. You have a choice between a Master's of Occupational Therapy or a Doctor of Occupational Therapy degree. In addition to the required coursework, the curriculum for both the master's and the doctorate will also include the fieldwork hours you need to sit for the licensure exam. If you are interested in more so advocacy and leadership roles as well as clinical practice, it's recommended then to pursue your doctorate degree as opposed to your master's. If you're attending school full time, a doctorate degree typically requires 3 years to complete, while a master's degree may only take 2 years to complete. Both of them would be considered entry-level degrees to beginning practicing occupational therapy. Occupational therapists work in a variety of settings, including schools. Some of these other settings that they work in can include nursing homes, home health services, occupational therapy offices, or in hospitals. And again, this is one of the few degrees you can get where you can work with all ages. So you wouldn't necessarily be limited to just working with school-age children unless you chose to only work at schools. Next, we're going to talk about physical therapists. Some of the way that the job looks may kind of overlap with occupational therapy. However, they do focus on a different set of needs for their clients. So looking at the duties of physical therapists, generally, physical therapists design and implement physical therapy interventions that allow students to benefit from their educational program. They use exercises, stretching maneuvers, hands-on therapy, and equipment to help students. They also measure and document student progress resulting from the designed physical therapy interventions. They also teach and train family members and educational personnel in an effort to help the students achieve their IEP goals. They also adapt environments to facilitate student access and participation in educational programming. So the job growth for physical therapists is also way above average. The projected growth is 28% from 2016 to 2026. The mean annual pay for physical therapists nationwide is roughly above $87,000. And in California, it's a little bit higher, again, a little bit above $100,000. To become a physical therapist, it is recommended to get a graduate level, either master's or doctorate degree in physical therapy. However, I believe with a doctorate degree, you may have a bit more variety and in where you can work, as well as more opportunities for more leadership type of roles. You also need to pass any state licensure requirements for physical therapists, and you also need to pass the National Physical Therapy Examination. Like occupational therapists, physical therapists are not just limited to working in schools. They can work in a very wide range of settings. They can work in private offices and clinics, hospitals, clients' homes, in addition to schools. Thank you so much for listening to my presentation and learning about all these different specialists in the field of schools. There are plenty of different options you can go into with an education degree. So I'm very excited for the different careers that all of you may be interested in. Again, if you have questions, especially if you're interested more so in either special education teaching or school psychology, please feel free to reach out to me and I can talk to you individually, as I have background in both of these fields. Also, if you have time, I would really appreciate if you could fill out this form to give me positive or constructive feedback on this lecture. Please let me know if there's anything that you liked about this lecture or if there are things that you wish I had included to talk about each of these different roles. Thank you so much, and I hope you have a great rest of your day.